If a therapist is working with a child, play therapy is the way to do it. They don't have the same capacity to express about their emotions as a full-grown adult. Play is their language. Play is the way that they learn about the world around them. Play is the way that they express. So giving a room full of toys, which will be words for their expression, is the way to understand what's going on in their brain, how they see the world, how they see themselves, what their perspective is on their situation of life. If we do it in their language, if we allow that titration of them touching into the difficult emotion, being able to pull out, that sort of experience is going to make it tolerable and allow them to even make sense of a really difficult thing from a distance first. This is about the dinosaur not having friends, not this is about me not having friends. It's kind of gives a space so that they can do it at the distance of the metaphor and story before they're able to talk about it head on, about this is me talking about me. The role of the therapist in play therapy is to be present, to be attentive. Isn't that what kids want anyway? How many times when you're with a child are they saying, hey, watch, hey, look at me, hey, can I show you something? Like, they just want our attention. They want someone to notice and they want to feel seen and heard. And to have our full attention communicates you are worth attending to. You're worth being seen. With a child, you're going to build rapport, you're going to build a relationship through their language of play. And relationship is the core principle of any therapy. When a therapist is trained in play therapy, joining their world, not asking them to be an adult to be able to articulate to their emotions. There's a quote that's attributed to Plato that says, "You can discover more about a person in an hour of play than in a year of conversation." And it is coming out in a puppet show with the way that the characters interact with each other. It's coming out in a sand tray with the dynamics that are being represented. It's coming out in art. Giving raw materials to a child to create anything that they want to create will tell you a lot about what's going on for them. The toys are selected specifically to allow for a space for the child to express themselves, like a doctor's kit, a kitchen or play food. There's certain symbols of nurture and healing that are embedded in that type of play. There's gonna be a dollhouse. I have 2 dollhouses because I work with children from divorced families that live in 2 different homes. There are puppets for puppet show. A playroom can have costumes available. Dressing up is a beautiful way to take on a character, to embody a certain feeling or to act out things that maybe we can't do in real life but we can grant in fantasy. The playroom is meant to have all of these available so that the child can gravitate towards the area that they need. And I trust that they do gravitate towards what they need. I use play therapy in both non-directive and directive ways. The non-directive approach puts the child in charge of deciding what it is that they want to do. And there is something that's really beautiful and therapeutic about just that. They realize through choosing that they have ideas that count, and it develops a sense of capability when they're engaging in certain play activities that are challenging, trying to get the bullseye when they're throwing darts, trying to make a basket on the basketball hoop. When they overcome that challenge, it instills that sense of, wow, I can do things. If I have a kid that wants to go to the sensory playroom, we're gonna go to the sensory playroom. That is their opportunity to move their body in an expressive way or in an aggressive way to allow them to regulate through their body. The sensory playroom is an area that has tools that activate the internal senses to allow that child to calm their nervous system through their body, through swinging, jumping, stretching out in a body sock, through beating up a monster. In more directive play therapy approaches, the therapist is using playful approaches to build skills such as emotional regulation, emotional identification, building emotional vocabulary, understanding that somatic experience of emotion inside the body. We're gonna learn about how to regulate emotion. We're gonna learn about the body sensations of emotion. We're gonna use expressive arts to do that. We're gonna use playful ways to experience and to understand emotion better. I often will use play therapy techniques with adults. For instance, if there's an emotion that comes up that's really difficult for them to access or express, like anger, I'll have them draw the anger, and then we'll put that up on the wall and we'll use a splat egg and throw it at the anger, because getting the whole body involved is helpful in discharging. So throwing, having that muscle tension and release happen is helpful. Before meeting with a child client, I will meet with the parents for an intake session. That's my opportunity to gather as much of the big picture as I can, asking questions about the history and the relationships and the family and some of what has led up to this child now coming in for therapy. Sometimes I'll bring parents into a session or allow them to be a part of the play therapy session because that's going to be to the benefit of the child. Regardless, I'm going to be meeting with those parents throughout the child's therapy journey for parent support meetings to talk about what's going on, what I'm observing in therapy sessions, to work together as a team for the benefit of this child. Play therapy, it's not just fun and games, it is using the child's language to do the work that they're here to do.